Doctors who make honest mistakes will get more support, vows Jeremy Hunt. The health secretary has accepted the main findings of a review of gross negligence manslaughter prosecutions in medicine. He ordered the inquiry by respected surgeon Professor Sir Norman Williams after an outcry over the case of a doctor who was struck off following a 6-year-old's death in Leicester in 2011. A hearing heard that paediatrician Dr Hadiza Bawa-Garba, who had an impeccable record, was working in an understaffed unit struggling with a computer system failure. She had not had a break during her 13-hour shift dealing and did not get the back-to-work induction she should have received on returning from maternity leave. Her own notes on the case and admission of guilt were allegedly used against her, although her lawyers said these were never submitted to the court. She was convicted of gross negligence manslaughter in 2015 over Jack Adcock's death. In January this year she was struck off the medical register after the General Medical Council went to the High Court to overturn a tribunal's previous ruling that she could continue to practice. Angry doctors said important staffing and other issues had been ignored. Sir Norman calls in his report today for a clearer understanding of when gross negligence manslaughter actions will be pursued, so professionals know it will be only in cases of very poor performance, not honest mistakes. He wants to strip the GMC of its power to appeal against rulings by the Medical Practitioners Tribunal, and says watchdogs investigating someone's fitness to practice should not be able to request their reflective notes on cases, to ensure people are not deterred from being open and honest about their performance. Sir Norman said his report aimed to encourage a just and learning culture. A clearer understanding of the bar for gross negligence manslaughter in law should lead to fewer criminal investigations which are limited to just those rare cases where an individual's performance is so truly exceptionally bad that it requires a criminal sanction, he said. This clarity, together with an understanding by the investigatory authorities as to the complexity of modern healthcare in which the individual operates, should help to dispel the real fear felt by healthcare professionals who are concerned that in the well-intentioned discharge of their duty they may be subject to criminal or regulatory processes. Mr. Hunt responded, "I was deeply concerned about the unintended chilling effect on clinicians' ability to learn from mistakes following recent court rulings. And the actions from this authoritative review will help us promise them that the NHS will support them to learn, rather than seek to blame." He has also announced a program offering NHS consultants confidential data on their outcomes and how they compare nationally, to help them to learn and improve. To reassure patients, meanwhile, he is promising better scrutiny of deaths in the NHS, with senior doctors examining all cases that do not get referred to coroners. The aim is to help grieving families understand the circumstances and provide data to prevent future avoidable deaths.